We're here with David Miller, CSO of Covisint. David, thank you for coming.
You're welcome.
You are intimately knowledgeable about the security issues facing health information exchanges today. Tell us what we need to know.
Well, Michael, there's a real big issue with security in general when you talk about internet and IT infrastructure. Right? So we're all kind of used to the idea of web banking and getting online and exposing that type of information electronically. But the issue in healthcare is unique in that the fact that the data that's being secured is data of a third party. So think about it. If you talk to a automotive company, if you talk to a law enforcement agency, they kind of own a lot of that information that they get, right? A lot of times it's intellectual property. But in healthcare, the information that is stored is information about patients, right? So it's not the doctor's information that needs to be secured, it's the doctor's patient's information that needs to be secured. And a lot of folks are kind of ignoring the fact that that type of security requires some additional protocols to be able to secure them. So for example, we all know about the bad actor kind of thing, right? So we all know about hackers, and we want to keep hackers out. So that's one level of security, right? So think about your healthcare information that is being exposed out there, that is being shared across the internet, for example, with other physicians. Well, you want the bad guys to not be able to be in that, right? So you don't want hackers to be able to get in and hack into that. The interesting thing about healthcare information is, unless you're the President of the United States or unless you're a major actor, hackers don't want to hack your healthcare information. They're actually not interested in getting the average Joe's information about his blood type or things like that. And so that type of security, we don't see a lot of that type of attack, right? The problem becomes that what happens if my healthcare information accidentally gets exposed out? Or what if the access is given to someone who shouldn't get to it? So in other industries, the information like intellectual property information is focused to a very, very small group of people. If you're building a vehicle, for example, and you've got drawings for something, there may be 10 engineers in the world who get access to that drawing information. It's very easy to secure access to 10 people, right? I can kind of lock that down very easily. But in healthcare, my healthcare information is probably accessible to every physician and healthcare professional in the region. I mean, I want to make it so that if I go to an ER that maybe is not in my town but is in a town over because I get into a car accident, I'd like that physician to get access to my healthcare information even if it is somewhere else.
Exactly.
Right? Or if I get sent to a specialist, I would like that specialist to be able to get access to that healthcare information. I don't want to have my physician say, well, there's only 2 other physicians in the world who I can refer you to. I want to be able to refer to everyone. So think about it. There are thousands of people who are going to be able to have access to your healthcare information. And these thousands of people are doctors, right? They may be people in the ER, like nurses, who would get access to information because they administer drugs. Securing that has some unique issues because now you're talking about giving the right set of information to the right set of people, but keeping it so that it's just not a publicly accessible thing, right? And so the types of things that we at Covisint really look at from that, because we kind of sit in the middle, right? And so we sit in that boundary between the inside world and the outside world. In the old world, the way that security worked was, if you could get in the hospital, then you had access to the healthcare record. Right? If you could walk up to the filing cabinet and open it up, then you must have been a physician or someone who needed access to it. Even when there were internal IT systems, if you had access, those systems were only accessible internally. There was a terminal that was in the ER, and to be in the ER, you had to be in the ER. You couldn't just walk in. Now we're exposing all that information out using the public internet to external organizations. And what we do at Covisint, what we have seen is now we're not talking about hundreds of doctors, we're talking about thousands of doctors in multiple places. And so the 2 things we need to do is find a way to secure that access so the bad guys can't get in. And honestly, that's not as hard as it seems. A lot of technology to do that. But the second thing is to then say, how do I identify all of those users, all of those physicians? How do I know that that physician is who he says he is? I can't have every physician in a region go to every hospital and sign up, right? I mean, imagine if you were a physician and it was, you have to spend 1 week every month going to every hospital and clinic and introducing yourself and saying, hey, I'd like an ID on your system.
And that would work.
Right? That wouldn't work very well. Right? The other thing is, I also can't make it so that I have to have separate IDs. Imagine that for your physician to get your healthcare information, he had to log in 100 different places. So that the way that it worked is, I'm just going to log into every one of the diagnostic centers that are there to try to find your information. So that doesn't work either. So what you want to do is allow a physician to identify himself once, but identify himself in a way that you know he is who he says he is. And so systems that allow the vetting of an actual physician are extremely important. And I actually I testified in front of ONC, Office of the National Coordinator, where they talked about what are the things that the ONC can do. And one of the things that I brought up was, I think that the government should enumerate every healthcare professional in the United States. Now, no one likes this answer. Politicians are like, that's kind of big brother-ish. But if you think about it, imagine that every physician, every person who got access to healthcare, so maybe it's nurses, nurse practitioners, others, chiropractors, physicians, all got issued some sort of electronic ID that allowed them to identify themselves to a region, to a RIO, right, for the purpose of getting exposed information. Because that's one of the major issues, is how do I know who you are?
It would identify them when they logged into the system.
And when they logged in, and they would actually be given some sort of a credential. And what's interesting is the government does this today, right? So when I get onto an airplane, to get on that airplane, I have to show them an ID that is issued by a government agency. I show them a driver's license or a passport. That's how they know. The person who's at that counter does not know who I am. They don't know who Dave Miller is. But when I show them that ID, that links my identity via a picture to me. Imagine that the government issued an electronic ID to healthcare professionals, so that every healthcare professional had an electronic ID that could be presented to a system or to an exchange that would identify that person, at least who they were. That system then could decide what they get access to.
It would control
right?
access.
Yeah, which is the difference between authentication and authorization, right? Authorization is not a difficult concept, right? Authorization is, I'm Dave Miller, and if I'm Dave Miller and I'm not a physician, I only have access maybe to my medical records.
Sure.
Or if I'm Dave Miller and I'm a podiatrist, maybe I don't get information about my last glaucoma test. But if I'm Dave Miller, maybe I'm an ER doc. ER docs have the ability to get a lot more, right? You never know what information they need.
Sure.
They need to know I'm on glaucoma medication. But that's authorization. Authentication is, how do I know you're Dave Miller?
Right. That's a very good point. David Miller from Covisint, thank you very much for coming to see us.
Thank you.
Thank you.